Hi, Dr. Keith Forwith coming to you from Louisville, Kentucky. Continuing discussing the basics of the thyroid gland, we want to ask the question, what happens when there's either too much or too little thyroid hormone? So, this is a subject that we can talk a long time about, so I'm just going to cover the basics here. We'll have another video covering in more detail both of these conditions, but as an overview, what you should think of is that the thyroid hormone sets the basic metabolic rate for the body. And so when you don't have enough hormone and you are hypothyroid, you're going to have a system that we can kind of describe as sluggish. Okay? So what you see on this side very prominently is you see things like fatigue and weight gain. A lot of times people will have dry skin when they're hypothyroid. You can see depression. Basically, an underactive system, and the list goes on. It's a whole lot of things. You can have constipation. You can have all kinds of things happening without enough thyroid hormone. On the other end of the spectrum, and this is kind of a funny thing, people expect that if this is what you get with too little thyroid hormone, then you must have just the opposite on the other end of hyperthyroidism. Well, in some cases that's true. You may have on this end some weight loss, okay? You may have on this end not fatigue in the sense that we get it with too low hormone, but definitely you can get fatigue over here with too much thyroid hormone. And the main reason for this, and it's very misunderstood, is that when you are hyperthyroid, it is most frequently difficult to fall asleep, difficult to stay asleep. In fact, most people who are hyperthyroid, if you put them into the sleep lab, what you would find is that they are staying in a very light stage of sleep. And if you don't get into those deeper stages of sleep, then you don't feel well rested no matter how many hours that you spend in the bed. And so hyperthyroid patients are almost always fatigued if it's gone on for very long. Also with hyper, you can have anxiety. Now, if you already have anxiety, hyperthyroidism will just make it worse. And if you don't have anxiety, you may find that you get it if you become hyperthyroid. And then there are a lot of other things with hyperthyroidism. Again, we'll go into it in more detail in a subsequent video. Heart palpitations are very, very common. An increase in blood pressure is very, very common. Lots of things go wrong when you are hyperthyroid. One of the most bothersome things that goes wrong is that your moods are very, very shifting. You can find what we call an increased lability, meaning that you're fine one moment and the very next you're either upset and crying or angry, and you can just go from one very, very quickly to another. We always tell people when they're hyperthyroid that you are just not yourself when you're hyperthyroid. Now, hypothyroidism is no treat either, but the big differences are that when you're hypothyroid, you just don't feel like doing anything. You're kind of that couch potato, that slug, and you just want to sleep all the time, and you don't have the energy to do much. But you're also fatigued over here as well. And so oftentimes we'll see people who think they're on one end of the spectrum and they're on the other, and that's where labs come in. And we're going to talk about that coming up in the next segment. Stay tuned for more videos. They'll be coming forth with more detailed videos on all of these different subjects. If you like my videos, you can subscribe to the channel and then you'll get notified if you hit that bell icon when more videos are coming out. Feel free to leave comments below. I can't answer any specific medical questions that you might have, but I'd love to hear suggestions on what you'd like to see in further videos. Remember that these videos are for educational purposes. They're not to give specific medical advice. That's your doctor's job. Thank you for watching my videos. I hope you found them educational.